Shall I start?
Yes, sir.
Yes, yes.
Good evening, delegates and participants. Thank you for joining Shield Connect. Today we are back with our famous series Icon with Dr. Ritu Santwani ma'am. And today Dr. Ritu Santwani ma'am is herself icon for the topic. Let's talk about cause to pose on menopause. And let me introduce Dr. Ritu Santwani ma'am. Ma'am is obstetrician and gynecologist, IVF specialist, founder and CEO of 360 Degrees Healthcare Studio. Ma'am is consultant at Inamdar Multi-Speciality Hospital in Pune and infertility test tube baby specialist. Ma'am is also a part of NUHS, a Singapore co-founder of MAAM, board member of SWWC. So I welcome Dr. Ritu ma'am for this program, and I hope this discussion goes a lot on this topic. Thank you.
Yeah. Thank you, Nishan, and thank you, Shield Pharma. A warm welcome to all of my dear friends who have joined all across the geography. Yeah, a warm welcome to my very dear friend, Professor Dr. Rajeshri Katke. A warm welcome, dear. Welcome, Dr. Sangeeta, madam. Dr. Sangeeta Shrivastava, welcome. Welcome, Renu Bhatia, madam. Renu Bhatia, madam is a very big name of the north. Yeah, hi, Shalini. Yeah.
Hi.
Hi. A warm welcome to all dear friends. As last time we have discussed this time we are going to have a discussion mode. So we can take questions one by one. If any one of you are having any question, please put in the chat box. So we will start discussion over that. Related to menopause. Our topic is today is related to menopause. Yeah. If the questions won't come, then I will start asking the questions. Dr. Chinmay, how are you? Dr. Chinmay is our dear friend, joined from Nigeria.
What is the age we take as menopause? Actually, what is a normal age? Normal means average.
Yes.
Because it was before 51. Now they say it is up to 58. Even 58 can be normal age. 40 to 58. Have you read this, Ritu? I have read it recently. So I am just wanting to clear it.
Ma'am, as you told, yes, recently what you are telling is correct. But recent data, yesterday only have gone through one paper that all are showing up to the 51. But I also know
it was 51, but latest I studied about the. That's why I want to clear it. Are we taking in private practice as 58 if the patient comes to us with 52 and complaining of bleeding? So should we be worried about it, or that she is having late menopause, or it is a normal one?
So we will take Dr. Rajeshri's opinion. Today Dr. Rajeshri is with us. Acha, meanwhile, I will welcome two dear friends have joined. Yeah, welcome Dr. Pushpa Kaul madam. And hi Dr. Munisha. Hi Krati. Hi Rohit. Hi Tajwar. Yeah, warm welcome. Yeah, hi Dr. Shikha too. Yeah, Dr. Rajeshri. Yeah. You're muted.
Hello, good evening to everyone. And hello.
Yes, you're
audible.
Yes, audible.
Yeah, I think both of you are right. Actually, what madam was saying is that whenever the age of the menopause has been getting advanced earlier, so we are getting the practically patients around sometimes at 40, 45, 48. Irregular menses, the history of cessation of menses or approaching to the menopause. So it is getting a year which is having, it comes in many of the patients in 48, 49, 50. This is the practical experience. And what madam want to say is that whenever they are having any menorrhagia or bleeding PV, so don't ignore. Sometimes we don't know that could be the cause of endometrial hyperplasia and all. But globally, they have said around 50 to 52 is the age of the menopause. But in a practical point, if suppose patient has many of the patients, they are coming with the early menopause. We can't say like a premature menopause or the premature ovarian failure. That is what my practical and the theoretical experience over this. So climacteric age has to be taken, individualized nowadays, and we have to see the symptoms. And according to that, we have to see literally it is a menopause. That's why she is bleeding. Or suppose there is a irregular menses and endometrial hyperplasia, and she has been, bleeding with either simple or the complex hyperplasia. That we have to take it out in consideration.
True, agreed. Anyone wants to add anything?
The point we are more worried about that,
Yeah. Anyone wants to add anything? So everyone is agreed now that what we have discussed, what the recent data also suggests for the 51 years. No question is coming. That means everyone is agreed. So I have received one question in the inbox.
Yes.
Huh? Acha. She is writing not take my name. Okay. Want to clarify regarding the different options for the menopause hormone therapy. Yeah, hi Asha. Dr. Asha, hello.
Hello, ma'am.
Yeah. So, Renu madam, we will start with you. If you want to suggest anything.
The hormone therapy, so we have to give estradiol and progesterone. And if the uterus is there, so we have to give progesterone also, because otherwise there is endometrial hyperplasia and the patient will have bleeding. But if hysterectomy has been done, so we can give only estrogen, and that is better, because if we give progesterone, that is supposed to, it is said that there are increased chances of CA breast if progesterone is also given along with estrogen. So if there is no uterus, we can give only estrogen, because at least chances of CA breast will be reduced. So both therapies can be given oral, it can be given oral, it can be given in form of patches, it can be given in form of rings, or now recently sprays are available.
Madam, you have, yeah, Rajeshri, I will take you only a second.
Yes.
Yes. Madam, you have any experience with this estrogen transdermal patches for the HRT? How you are finding the results?
Yeah, same as your oral estrogen.
Okay, you're finding good results, but somehow I am not finding good results with the HRT patches. I don't know whether being a tropical country, some patients are complaining, a lot of complaints that, ma'am, we are not properly relieved. So I want to take opinion of everyone. Sangeeta madam, if you want to highlight something, please tell us. Madam, you are muted. Madam, you are muted.
Ma'am, muted.
Practically, I will prefer to give the mixed therapy. That's a combination of estrogen and progesterone for the 21 days. What I prefer.
Okay. What's your opinion regarding the use of this transdermal patches of the estrogen these days? So many companies have launched. So what's your opinion regarding the use of that? Has anybody has used, can share their opinion? Meanwhile, yes, Dr. Rajeshri, yes, please enlighten us. Yes, yeah.
I was recently, last week only, I was on the panel of breast concerns with the Mumbai Obstetric and Gynec Society. And in that, there was one guest lecture was there. The professor was from some European countries, and he has an extensive, vast experience in a transdermal patches.
Okay.
So in that, he gave for an hour of the lecture. And in that, what he has said that because they have done a cohort and trials in that also with the transdermal patches, and madam has rightly said, Renu madam and Dr. Sangeeta ma'am, and there are sprays. But with the sprays also, there are gel also, putting of that and the transdermal patches and all. So in that, I was interested in knowing that if they have studied about the rate of, CA breast in the patches and in the normal thing. So according to them, there is no rising of the incidence more with the HRT if they are using with the transdermal patches, because that can bypass the metabolism, because we are using either subcutaneous, or if you are using for the genitourinary symptoms with the vaginal estradiol or the estrogel and all, it's like that. So that is the one thing. So they can use safely. That is what he meant to say. And even the most important thing is that apart from the CA breast, what we are more worried in the menopause is the increase into the risk of the cardiovascular strokes, diabetes is there, metabolic disorders, endocrine disorders, hypothyroidism, osteoporosis. These are the main, and the genitourinary symptoms like, vaginal dryness will be there, incontinence is there, and of course, psychological and the psychosexual. So these are the symptoms where the women, they are more worried about that. So if you can give with the less of the side effects and some of the estrogen, and rightly said Dr. Sangeeta ma'am and this Renu madam also, if the uterus is out, then you don't have to go give for the progestrogens or the progesterone, but estrogen, and now we are having a low estrogen in that. And you are also rightly said that, because I asked the same question to them. Being a tropical country and most of the sweating is there, so most of our patients, they are practically, they are saying they are not much benefited with the transdermal patches. That is what the thing is that. I asked him through, so he said that it's not like that, humidity doesn't play a role in that. But practically, I have read some literature also in that, and experience with the patient that there is a definitely with the, if suppose they put a patch on the back, arm, or thighs and all, and there is more sweating is there, then they delays the absorption, or irritation is there. They are not very much comfortable with that. But one thing is that they're happy that they don't have to pop out the pills.
Very true, very true. Yeah, thank you, Dr. Rajeshri. There is one study has come, only the patients, the menopausal patients which are who are suffering from lot of genitourinary problems. In that
Yes.
cases, the use of the estrogen spray is having a little bit more beneficial.
Yes.
Some studies have come, still a lot of work has to be done, but some studies are favoring for that.
Gel is the one, local gel is the one important for the genitourinary, because that will absorb into the vagina and it replenish the thinness of the vaginal wall, that epithelium. It strengthens the immunity also there.
Yes, vaginal atrophy and all that, it is helping a lot. So the study was in comparing for both of that the transdermal gel and the estrogen spray, because that are available only from one or two company. So they find the sprays are having a little bit more better results. Yeah, hi Dr. Rashmi. Rashmi has also joined. Welcome. So Nishant, meanwhile, in between, you please take the questions. I'm not able to open the chat window. Nishant, Dr.
Yes,
Nishant, are you there?
I am there, ma'am.
Acha, okay. If any question is received, please take it.
Sure, ma'am, I will take it, but I could not see this question properly. One of the question is from Dr. Monica Tomar, that she gets lots of patients, and one of this patient of 59 years with regular but heavy bleeding. Only that is written.
But what is the age of the patient that you have to ask?
59 years.
Then she should go for a hysteroscopic DNC and see for the ultrasound endometrial thickness is how much is that, because 59 is a late menopause. So in that late menopause with irregular bleeding PV, there is might be a chances you have to rule out about the C endometrium.
Very correct, very correct. Dr. Monica, something you want to ask, then please clarify your question. Meanwhile, I will take the other opinion. Now there are a lot of HRTs are available in the market. So 1 minute, one more question. Now it's open. Yeah. So yeah, the question is, doctor, your name is missing. How can we call you, pronounce you? So lot of options are available these days. So among these, how many of you have used the Tibolon for the HRT, and how you find the results? Of course, we are getting a lot of non-hormonal, lot of herbal preparations. Yes, estrogen, progesterone. So how many of you find the results with the Tibolon, and with which symptoms you are finding the more good results? Anyone can answer, Dr. Rajeshri, Dr. Renu madam. Yes.
I think Tibolon is specifically meant for the osteoporotic one. And that is one the thing. And second is for the, if more they are worried about the vasomotor symptoms, hot flashes and all. So in that, this is the Tibolon, and definitely it gets very useful in cases of the osteoporotic. Prevention of osteoporosis, or prevention of the fractures, or to have some strengthening of the bone. So they can use for that purpose.
Agreed. Agreed. Anyone wants to add anything? Renu, madam, your opinion? Madam is there or left?
I think I can't see her.
Okay. Okay.
Hmm.
Okay. Okay. Anyone wants to add? No, no one. Yeah. So, yeah, Dr. Rashmi is asking, in patients undergoing PAH and BSO, what is the best choice of HRT post-menopausal like 50 years?
If you can, acha, I want to, can I answer this?
You can,
Yeah,
no
sure.
problem. Yeah.
They say whenever there is a surgical menopause is there, then this menopause hits very badly, and it is the two important thing. One is a healing of the wound or the inside, and second is the well-being, because sometimes they get so much of psychologically depressed.
Very
so give
true.
such patients with the oral first, and then you can switch over to the either spray or transdermal, because that is the one thing, whether they are more worried about that stress of surgery, then changes with the menopause, because this is a drastic change into the hormones, where we have removed the ovaries and the hormonal resources in that, and there is a surgical menopause for that. So we can go for this with the oral one. Once she stabilizes, then you can give for the another options.
Very true, very true. Because in our India, somehow I have seen the acceptance to this transdermal patches and vaginal sprays and vaginal gel is still very less. We have to counsel the patient lot. Only except in the some very high class of the patient, those who are not ready for the popping of the medicines, they are only ready for this gel. Otherwise, I am finding great difficulty for counseling them. Okay. Shalini is writing. Yeah, hi, Dr. Shalini. Yeah. Good, you have put your name, Shalini. Huh? So, Shalini is writing, the estradiol vaginal cream is there. Any vaginal gel? And how and where is the spray used? Lot of companies are making, Shalini, these days. Lot of companies are making. So, brand name we can discuss in the group. You write in the group, we will discuss there. Huh? Lot of companies are making. Compared to there, so many patients are coming with this loss of libido after the menopause. Sometimes the husband is getting his wife that, ma'am, my wife is totally loss of libido. So what is the approach of the treatment? How all of you start the treatment in that patient? Yes, Dr. Asha, want to say something? Huh?
No, ma'am.
Okay. I thought you want to say.
Okay.
Yeah.
You want me to answer?
You can answer.
Anyone can answer, actually.
Yes, anyone can answer. Yeah. Anyone can answer. This is a discussion forum, not that. We are discussing. Anyone can answer. We can exchange our thoughts.
Yes. Basically, such patients, the counseling is the integral part of the treatment. That is the important thing, because they have the ideas that cessation of menses or menopause, that means loss of femininity or loss of sexual desires and all, though there is a libido. And proper counseling, reassurance, and third important thing is that if she has some inhibitions because of the vaginal dryness, then they can use some lubricant gel, or if pain is there, then they can go to the anesthetic or the analgesic gel and all. These are the some of the things in that. But suppose she has so much of psychosexual inhibitions, and mind changes is there, then definitely we can put her on the MHT, I mean menopausal hormonal therapy on her, and we can counsel for that, because one has to accept the part of the life is that gracefully, that once how we have a menarche, then reproductive age, then the perimenopausal and the menopause. So definitely not only the HRT, but this helps very much. Generally, most of the female, even they are very happy with the vaginal lubricants. Some of them, they have a dyspareunia, so they are happy with that also. And with counseling, even with the both the parents, even both the I mean husband and wife or couple, then it is very important. In this, I think we can talk to the husband also, because the family has to understand the woman, that because the whole life she is understanding everyone, and if she goes in a cessation of menopause or climacteric changes, then we can to take her in consideration, and to boost her moral also, to understand her, we have to counsel even to the partner also. That is what and I do personally. I am getting lots of right from VIP patient to the patients like this. So I always tell them ki you have to understand to her also what is the problem. Medically also we can treat her, but even counseling and reassurance, definitely it helps.
Very rightly said, Dr. Rajeshri. Yes, counseling plays a very, very important role. Yes, and some patients are coming in whom, even though we start the HRT, but still they complain of this vaginal dryness. Main
Yes.
problem is that, like, first is the loss of libido, second is the very painful intercourse, and third, some patients are feeling that they are not reaching up to the orgasm. So a lot of preparations are available these days. Yes, of course, we are giving the MHT, and along with that, we are giving some isoflavones, and glycerin gels are also available. That also act a very, very good. In some patients, में क्या होता है, sorry, I will speak in English. Last time also, a lot of doctors have joined outside there. So in that patients, even though we give the HRT, but there's a local dryness is not going immediately after that. In that patient, this isoflavones and glycerin gel do a very, very, very good results I am finding. Besides that, yes, besides that, we have to tell them about some of the dietary changes, the foods which are helpful in increasing the testosterone content, and whatever the colored fruits are available and vegetables are available, that also plays a very, very important role. Aphrodisiac fruits and foods we all know. So if anyone wants to, can add that also in diet. If anyone wants to give some highlight on that, all opinions are welcome.
Yes.
Dr. Kalita, yeah. We are usually writing in our prescription, because patient हर बार ऐसा पूछता ही है कि ma'am, what are the dietary changes we are going to do? This is a very common question. We all are getting this kind of question ki what are the dietary changes we have to advise at the time of the menopause? Anyone can more?
Yes,
And, yeah.
it's very rightly said,
Yeah.
Dr. Ritu.
Yeah.
Menopause treatment is not only the MHT or the HRT treatment, but basically it is the pharmacology is different, but non-pharmacological. The most important thing is about the diet, what you have said.
Very
so,
true.
Soybean and the phytoestrogens are the important.
Yes. I want to listen that
what I
only.
would
No
like
one is
to
saying, huh? Yes, soybean.
so that
Yeah,
then
soybean means
black cohosh, soybean.
Yes, flax
So
seeds.
these
Flax
are the
seeds
things,
are very good. Fennel seeds are
very good
very
in
good.
that.
Because these days everybody is so much enthusiastic about the seeds. Ma'am, कौन से seeds खाएं? Which seeds we can take, which are very good. From the youngsters to लेकर till menopause, whatever the ladies are coming, all are seeing so many information in the Google and YouTube that all are asking. So flax seeds are very good. Fennel seeds are very good. Yes, as madam has told. Yes, soybean. Yes, soybean means phytoestrogens is very good. Fenugreek they can take. That is also very good.
Very good.
Hi, Rekha ji, welcome. Rekha ji, my dear friend and senior, also joined here. Rekha ji, welcome.
Thank you, Dr. Ritu. Thanks a lot. I was just,
Hello, Rekha ma'am.
Yeah,
hello.
Hi.
Hello. You brought out a very nice point, na? That soya bean should be told that these nuggets, nuggets,
soya sticks, soya cubes.
Acha, soya. What other seeds just now you said?
Flax.
I thought flax seeds. Flax seeds, fennel seeds, that all are very good.
Walnuts.
Yes.
Some of the raisins, black cohosh.
Yeah, black cohosh. So these days, lot of preparations are also available for the black cohosh. So that is also very good. Earlier, it was not available easily. Now these days, lot of companies are making for this black cohosh preparation. So that are also very good.
And one important thing, Ritu, I would like to add is that
yes.
they should do the exercise which strengthens the perineum. That is
Very
the one
good.
thing.
Very good.
That is a very nice. This yoga helps in that. Apart from the muscle strengthening, walking for a general well-being, but for the perineum and female sexual organs, for that you can say that yoga may, apart from the Kegels exercise, Ashwin Mudra is there, if they have to hold it, do the buns, and then they can strengthen it. If you do the exercise and all these things, even most of the glands which are there, they pour the secretions in that also. That is the thing. So it is very important. Not only the diet, medicine, but the exercise is very, very equally important for doing this.
Yes, diet, exercise, medicine, and meditation. All are very.
Most important is the acceptance of menopause by the
yes,
person
yes,
and the family supporting
yes.
Because that is the life is there, you have to accept it. But most of the women, they are more worried when they even we do worried, see the white hairs or wrinkles or whatever, yeah, mood changes, mood swings and all. So half of the problem comes down there only when they accept that, oh, this is going to happen to me, I am aware of this, and I have to understand it, and the family also will understand it, and that minimizes the most of the problem, and rest of the problem will be with your treatment, diet, exercise. So she can move smoothly with the menopause. That is what I always plan with my patients.
Okay, very
and
nice.
Of course, the calcium supplementation.
Yes.
Calcium supplementations, vitamin D, vitamin A, and vitamin E. This is omega,
yes, omega fatty acids. Yes, omega fatty acids,
this
omega
is very,
3,
very
6.
important.
Yeah, omega 3, 6, and 9 combination is very, very good for them. As you rightly pointed out, vitamin D, yes, of course, vitamin D, these days in etiology of everything, of course, we are giving vitamin D to each and every of our patient. और देते क्या बहुत सारे पेशेंट्स तो पहले से लेते रहते हैं विटामिन डी विटामिन डी तो हम ले रहे हैं विटामिन डी
हम भी लेते हैं but still we are deficient whenever we do that.
Yes, that's correct, everybody say. So first now we are want to discuss about this, complete the portion of the diet. Anyone wants to add something more for the diet for the menopausal ladies? Any more precautions we have to keep in mind for the diet? Anyone wants to add? Can add. Anyone, if you want to add, can add.
In cereals, you can add with the, jawar will be gluten-free things, and the millets nowadays, it is one of the good thing. And you should have less of fat, less of fried things, and go more with the, natural, complete vegetables. Protein should be more, but it should not be artificial. That is how the balanced diet will help.
So, as Dr. Rajeshri told, so yes, we always advise that depends whether you want to go for a gluten-free diet or not. These days, lot of studies are coming for the gluten-free, but the taking lot of millets is very good. And our Indian diet is full of the millets: jawar, bajra, ragi, nachni. These all things are very easily available. Yes. Other question, very importantly, these days the patients are asking me, ma'am, at the time of the menopause, our weight is gaining. So is it like that I will stop totally the carbohydrates? So how many of you are in the favor of that? We all are seeing a lot of videos these days regarding the for the carbohydrates. So no. Yes,
see,
correct.
One plate is there. In that plate, ideally, you should have half of that is contained should be either vegetables or the fruits is there. 1/3 it will go to the proteins, and in the remaining 1/3 it should go for the carbohydrates, because that is also very important in that. So ideally it should be a balanced diet. That is one thing. Second important thing is that it should contain the seasonal fruits and the vegetables. That's more than enough for us. You don't have to take, extra things and extra more things, and easily available, because every tropical countries or every country, they have their own fertilized soil and own maybe crops they are coming here, which are suitable to us, so I think that is enough in that. You should not go for these crash diets or zero diets and all, whatever. I am not very much, in that perfect. I don't know much of that, but I am not for that actually. Yeah, they should eat balanced diet. Diet is not the important thing. The with diet, they should be in exercises. That is what.
So, as Dr. Rajeshri rightly pointed out, very true. And of course, we are not saying to stop completely the carbohydrate. In fact, the complex carbohydrates that are very beneficial. So we have to explain the patient properly. हम उनको ऐसा नहीं बोलते कि आपको total बंद कर देना है. Means we only say that they have to eat in the moderation and the balance amount about the potato and rice, as she told. But the complex carbohydrates are always better. But everything, if we can eat in the proportion, so that will not going to harm. So
sugar should be sugar. They should not use much. They should avoid the sugar. They should go for the jaggery, palm jaggery. That is one of the option for this. Then rice less in that. As you said rightly, potato, sweet potato. Sweet potato is better than our potato. So these are the things they can modify in their diets with their likings and all. And once in the while, it is good to take all these things, but not, it should not be a routine diet for like, eating pizza, eating burger, eating rice. So that shouldn't be there.
Here I want to highlight one point. Yes, we all know the sweet potato is having more fiber, more nutrients. But friends, if you are on your weight loss journey, remember sweet potato is having more calories compared to the potato. I have done my weight loss. I know this each and every point means sweet potato is having more calories compared to the normal potato. Chalo,
so
this
you
is
should eat half only, then skip your skip your lunch.
Very true.
Ritu has done a very good weight loss.
Thank you, Rekha ji. So, Dr. Seema is writing. Yeah, hi, Dr. Seema, welcome. I want to add the point that for the problem of dryness or itching of vagina, we should ask about the sexual life. Very true. We have just discussed this. They come out with the history of the infrequent sexual contact because they think they are old now and they should not have sex. They need more counseling. Yes, correctly. This is the thing only we have discussed. Yes, agreed. Yeah. Yes, Shalini, Dr. Shalini, very good point. She has pointed out among the dietary changes only for the lifestyle changes to avoid the alcohol, smoking and caffeine. Yes, very good. Very good. Of course, we are advising everyone not to avoid, but to have balance. Avoid karna in the metro cities is very problematic to tell anyone to avoid. The practical situations what I am getting, I am telling you that. Okay.
It's better to avoid, minimize the things. Suppose they are like smoking, 10 cigars per day. Then they should come down in that. If they are having tobacco chewing so much of that, we can tell them these are the hazards. Not for this, but even they will be prone for the various malignancies. That is the one thing.
The patients, see what the patients I am getting, they are not very much addicted to alcohol and smoking. They themselves, these girls or sorry, these ladies tell, ma'am, we are taking 4 to 5 cigarettes and alcohol on the weekend, but they are very much addicted to the caffeine. If we ask them, they tell, yes, हम 5 से 6 coke तो एक दिन में ले ही लेते हैं. So that caffeine, coke is having a lot of caffeine. So of course we have to advise them.
Yes.
Okay. Yeah. I think one question is missed. I don't know where is that question gone.
Weight bearing exercise when we advise exercises.
Very good, Rekha ji. Yes.
Should be done.
Yes.
By the menopausal lady.
Yes. That is the one thing where rightly pointed, Madam Rekha Madam. So weight bearing they have muscle strengthening and the bone strengthening exercises in that. So rather than the gym, many people they go for the gym and all, but if they maintain, then it's fine. Otherwise, they can work with the most of the exercise. They are very good if you do with the anti-gravity, you know. So that is
Yes.
the one thing, building the muscle mass and the bone mass for that.
Correct, correct.
And
Yeah,
in
Rekha, do you want
walking
to add
also,
more?
minimum 150-minute walk in a week.
Yes.
Now
Yes.
to these days तो simple funda we are using minimum 10,000 steps per day. जब तक 10,000 step ना हो जाए तब तक सोना नहीं है. चाहे
नहीं
आप
होते
रात में चलो,
10,000.
चाहे आप रात में चलो, चाहे आप दिन में चलो, चाहे आप दोपहर में चलो, आपको 10,000 steps पूरे करने हैं. अरे today I got one lady in the OPD. She is 54. Actually, she came to me for some breast issues. अरे उसको देखकर लग ही नहीं रहा था कि she is 50 or she is looking like 35, 36. And I asked her how you managed all this. So she told me from last 20 years, she is walking every day 24,000 steps per day.
Oh,
And
अच्छा.
she is the CEO of one big company, not a small. मतलब constant उसके phone बज रहे थे, constant उसके पास messages आ रहे थे, but somehow जो अपनी care करते हैं, somehow they take out the time. They are also one kind of example कि being so busy. Yes, being a CEO of one company is also not a easy job. They are also having a lot of responsibilities.
Uh-huh.
So yeah, Rekha, do you want to add something for diet?
No.
I think we have covered everything, na? Yeah. Or anyone want to add anything? Sangeeta madam, you want to add something?
No. I think we
Sangeeta
have
madam is
covered
looking
everything.
Sangeeta madam is looking very pretty on the top.
Yes.
I think we have covered a lot.
Yeah.
Only one thing has remained about the taking care of the heart cardiovascular diseases in that, because of the protection of the estrogen and the hormones, the men, they are having less cardiac issues than the men. But once the menopause approaches, they comes to the equal, and after menopause, they are more prone than the men. So they have to take care of that. So metabolic disorders and the lipid profile, whenever the patient comes to us, always go for the, even the normal patient, suppose 40 plus in that, go for the lipid profile, thyroid, and the blood sugar or the hemoglobin A1C, even because silently asymptomatic, many people we are picking up with this, you know, even with the post-COVID scenario also, many of them, they are having the abnormal glucose intolerance in there. So this is
Yes,
a
very right.
simple, I think, sonography. That is what I would like.
Very true. Dr. Chinmay, our dear friend from Nigeria, has joined. Dr. Chinmay, do you want to add something? What you are following in your country? Dr. Chinmay was the first to join for this webinar.
Okay.
Dr. Dirji, you are from which country? Till they are answering, we take the another question. Yeah, Dr. Shalini has raised a very good question. Dr. Rajeshri, I am pointing out this question to you.
What's that?
Yeah, how frequently to get pap smear and mammography after the menopause?
Yes. See, pap smear, so you have to do it, you know, absolutely more than 70 years, then you don't have to go for that. But pap smear yearly, that will be the good thing. If suppose she has something, generally they say 3 yearly, you know, once in a 3 year screening for that. But I would like to say that year men, they lost the follow-up. That is the one thing in that. And second is the mammography. Mammography is there is a vast discussion about the how to go ahead with the mammography and the sonography. In the last panel, I was also there in that. And there even I said that suppose the high risk patient is there, you know, suppose she has a family history, genetic history, BRCA1, BRCA2 positive, or you know, in that. So in that you have to start the mammography earlier, you know, you can do. Otherwise, after 45, you can do once and you can follow after 3 years also. And the second option is there are 3 things what we advise for the breast is that one is a self breast examination. We can train our patients to do the self breast examination, either with the lying down position, she can palpate the breast, or with the shower, when she goes to the shower, in that with the mirror in front of the mirror, she can see whether the size of the breast and all. This is with the lump she can feel, and she can go to the doctor. Second is a clinical breast examination, sonography. That is one thing where you
I think voice is breaking, Dr. Rajeshri.
If the video can put off, then I think
the
sometimes the
She will
voice
join
becomes
again.
clear.
Her place is not little bit the net is issue.
Acha,
Rajeshri, we are not able to hear you. Acha, meanwhile, we will leave this question for Dr. Rajeshri only. Okay, now next question we are taking. Up to how long we can continue the HRT?
One should go ahead with that.
I think she is logged out. Dr. Rajeshri, please give the answer again. You was not connected.
I was not connected.
No, we are not able to hear you.
We were not able to hear.
Okay. So pap smear you have to do yearly, whenever she comes for the follow-up in that. And because we don't have a loss of follow-up for our patients, most of them there, and they are more worried about that. Suppose she has in a pap smear any abnormality is there, then one should do a colposcopy in such cases. If there is a abnormal pap smear is there, the HSIL is there, LSIL is there, or if suppose HPV positive is there, then you have to go for that and come for the definitive diagnosis and the treatment. Apart from the for this breast thing mammography, before that I would like to say there are the 3 stages. One is the self breast examination. We have to tell our patients to do the self breast examination, either when they are doing with the lying down position or with the showers. The second is the clinical breast examination by the expert. When they are coming to the gynecologist, they can do the breast examination also as a routine part of the examination. And after 40, it is advisable to do that. You can see any thickness is there, pectoral thickness is there, any small lump is there, any discharge is there, or any nodes into the axilla. Third important thing is the sonomammography. Sonomammography is less of radiation, and in cases you can do the sonomammography. But in that, if suppose the microcalcifications are there, which is the point where you can diagnose the early malignancies, ductal carcinoma or the lobular carcinoma. So in that, you have to subject such patients to the mammography. Otherwise, routinely after the age of the 40, she can go for the mammography. If she is a high risk or genetic history, she can go earlier for the mammography also. And every 3 years, you can do it that. The problem is that suppose there is a dense breast are there, heavy breast. So in that, it becomes very difficult. In such cases, sometimes you will be needed a MRI of the breast and then come to the diagnosis. Was it audible?
Yes, audible. Agree.
Audible. So this is the perfect breast examination approaches. Towards the patient.
Friends, now I'm going to take the last 2 questions and then we have to wind off. So a very good question by Dr. Neelam. Ma'am, does calcium citrate has any advantage over the calcium carbonate for menopausal patients? Anyone wants to? A lot of companies these days are coming. Yes, another. Hi, Dr. Rashmi. Good, you have joined. How long the calcium needs to be taken in the postmenopausal patient?
So in a calcium carbonate, they says it's not much absorbed, and calcium citrate, they says that it is the absorption is more in that. Of course, we can't say promote any brand of anyone is that. So you can go with that.
So Dr. Neelam, here I want to add, these days the preparations have come with the calcium citrate maleate. They are showing the studies that CCM is having a more absorption compared to the any other. And this is not like that only in the menopausal, that the studies have shown that CCM is having a much more better absorption. So nothing like that कि अभी ऐसे बहुत studies नहीं है. We can't promote any brand, but as
And
Dr.
they says
yeah.
less of side effects like
Yeah.
constipation and all.
Depends on the patient. Depends on the patient's pocket also. CCM preparations are comparatively to calcium carbonates are much costly. Yes, if your patient can afford, then better to give the CCM instead of giving this calcium carbonate.
And I'll tell you what suits to the patient is very important, because for some of my patients citrate, they were not happy and they switched over to the carbonates.
Very true.
So that is, you can change the preparation according to that also.
Yeah. Other question is by Dr. Rashmi. How long the calcium needs to be taken in the postmenopausal female?
I think they should be supplemented till the things, because there will be a bone loss and they are prone for the fractures. So calcium should be the integral part. Only they can take with the breaks also, alternate day calcium if they want to. They don't want to get continuous calcium. Then second is that they can take the calcium rich food. That is also, I mean, curd is there, and in that, and in some of the nuts, they have a good calcium, almond, walnut, then pistas. So in that also there is a good source of calcium, because how much amount of the calcium is not important. The elemental and ionizing part of the calcium, which gets available for the body or absorbed, that is more important. So natural plus these things. And then fish is the good source of calcium. White egg is also good source. Those who are eating non-vegetarian, they have the ample amount of this. Vegetarian, they have with the vegetables and these nachni, ragi is the one where you will have a rich in the calcium and B complexes like B1, B6, B5 also in that, more in that actually.
Yeah.
So this is how, and curd is also very important.
Yes, and even one orange is having a lot of more good calcium. We are not aware of
guava. Peru.
Guava is also guava, and this guava and orange is also having a lot of good amount of calcium, because earlier we are considering that orange is only a citrus fruit, but that also contains a good amount of calcium.
Good amount of calcium.
Yeah. So yes.
And Dr. Rajeshwari, how much calcium to be prescribed to the menopausal lady? Like elemental calcium, if we see, so should it be 500 milligram twice a day?
Actually, ma'am, this is 1000 milligram is the total dose of that. So generally, either some of the patients, they are comfortable with 1000 milligram alternate day. That is one thing. Yeah, 500 milligram BD, that's also good for that.
But usually the tablets are not containing, Dr. Ritu, so much of elemental calcium. They don't contain 500. So then it becomes very difficult. You cannot tell her, because the compliance is lost 3 times.
Yes.
They hardly have 250
some preparations are there who is having the good elemental iron in that. Elemental calcium in that actually.
Plus depending on the patient's BMI, body weight also. Some patients are very lean and thin at the time of the menopause. For them, the 1000 mg will be too much. In that patients, we are giving around 500 only.
500. But for a prophylactic, go for a 500 milligram. And if you want to give a therapeutic, go for a 1000 milligram. And you can take a break also. Actually, 3 days in a week also, that will be what I feel ideally. If you want to reduce the toxicity also of that, then we can give a combination of diet plus calcium. That is the one thing. Second thing is that rather than taking daily, she can switch over 3 days for this thing.
Okay.
Somehow I plan like that actually, because
actually, Dr. Rekha ji, you have pointed out a very good point. So tomorrow I will see for this elemental calcium, which preparation. Dr. Rajesh, if you are aware, we can discuss in the academic group. Dr. Rekha is also in the group.
Yes.
So we can see in which brand it is having. We will give this work to Shalini. The young person can do this work very good. Dr. Shalini, so you find out in which preparation is having it, write down in the group and tag me in that, because all the posts these days I'm not able to read.
Ritu, I will also write to you.
Chalo, okay.
But,
Chalo, that's good.
Achha,
Yeah.
Then one small question, Dr. Aishwari, if she takes it daily, will it be overdose, like you're saying, side effects? Like if she takes one tablet daily, or
one
suppose
tablet is enough. Even I am taking one tablet, 3 days in a week sometimes, because my
No, but like supposing a patient is very, some patients are very religious, like they abide by the prescription. So if she keeps on taking without break, will it do any harm also? If every day the calcium is going 1000 milligrams to a lady?
No, ma'am. What we can do is that we should take a break. That is what I feel personally.
We know that's why Rekhaji's question is like that. If the patient is not taking a break, it is going to harmful for any point of view for the patient.
Harmful nahi, but suppose she has a prone tendency for the calcium precipitation or any stone.
Yeah.
That is the
So
one
we
thing.
have to advise these patients that the proper hydration is also very, very important. During the time of the menopause, also some patients say the urinary frequency is increased, comorbidities are there, diabetes and hypertension, and if the water intake is less, of course the patient will get some problem of the stasis. So
water intake, of course.
And generally, I'll tell you, no patient is very, our patients, they are sincere to take iron and calcium. So generally,
you are correct that the break is always very, it happens without the patient or us knowing.
Yes.
But is it anywhere written in the book that calcium should be taken with breaks? I am actually, for my knowledge part, I'm asking that should we take like vitamin D, they say take a break after 8 weeks. But in calcium, I don't think they, is it up to us that we take a break?
Rekha ma'am, these patients, they are having so much of constipation also with the calcium.
Okay.
And gases formation. Gases formation also.
And third, even they feel very warm with the most of the calcium and all. So immediately, even they know that these are supplementation. If they are not suiting, they will excuse it actually, because these are supplementation. So it is not a treatment also for that.
But
even
if
how many patients with the fracture also, they don't take religiously calcium. Even during pregnancy.
Rekhaji, you have pointed out very good point. We will also study this thing.
That if she's taking every day, it do any harm. She doesn't break.
This is about the stone. That is the one point. Precipitation.
Water intake should be good.
Water hydration should be there. And so prolong, even the orthopedic, they says like that only.
Okay. Thank you.
Yeah. Sarita madam, you want to add something?
Then in the dents, in the mammography, sometimes they show calcification in the breast, no? So is that also part of the oral calcium intake or something? Or is it entirely different?
No. That is not the oral calcium, but basically the there are two types of the calcification on mammography: macro calcification and micro calcification. Micro calcification and with dispersed granularity. That is the one thing where you have to pick up for that, earlier if any lumps are there or they are prone for the malignancies. But with this calcium, that doesn't have this thing. This is the only deposition of the calcium along the vessels walls, and that is giving it to the breast tissues.
Very true. Thank you, Rashmi, for such a nice comment. Rashmi is writing a very nice discussion is going on. Dr. Rashmi is my very good friend, though we never met, but we always have a discussion either on the Facebook or on the WhatsApp. See, this social media and in this digital era, a lot of friends we are having across the geography.
Yes.
Ritu,
1 minute. I would like to say thank you to you, and she's a wonderful friend, a great academician, and a very nice human being, and very knowledgeable, very keen on knowledge sharing things, and this is the best quality person. No, I'm not, just let me, because I am coming on this group platform for a first time. in this thing. So I'm really glad you have. She just told me in the evening at 5 p.m. I was sick. I was coming from the meeting, and she said you have to join for my meeting. So I said, "Okay." So that is the one thing. And thank you, Dr. Sangeeta ma'am, Asha ma'am, Shalini ma'am, Rekha ma'am, and Chinmay, and everyone from bottom of my heart. Thank you very
Dr.
much.
Rajeshwari, you really enlightened us very well, and added to Dr. Ritu. So Dr. Ritu is always, your words are very true for Dr.
Ma'am,
Ritu.
she is doing a wonderful thing, because these are the small things, and in the practice it becomes very difficult to whom to ask and what to ask. So everybody here is a knowledge sharing. So I think, Ritu, you should keep on
Thank
taking
you,
all.
thank you, thank
We all
you, dear
join and we
Rajeshri.
can
You made my
contribute.
day. You made my day. Thank you, Rekha ji. Chalo, let's wait. 2 more questions are there. We will finish off that questions and then wind off. Huh?
Yes.
So, yeah, Dr. Rajkumari has joined now. Welcome, madam. Dr. Arvind Tiwari, welcome, sir. Again, today you are late. Dr. Arvind told me last time discussion he left. So, yes. अब इतना सो कर सब लोग क्वेश्चन लिख रहे हैं, पहले क्यों नहीं लिखे क्वेश्चन? अब मैंने बोला मैं वाइंड ऑफ करूं तो इतने सारे क्वेश्चंस आ गए. हाँ, सो या डॉक्टर शालिनी, अ वेरी गुड क्वेश्चन. डॉक्टर राजश्री एंड डॉक्टर रेखा जी. Yes, this Dr. Shalini has raised a very good question. When to start the thyroid treatment in raised TSH in menopause?
Very good question.
So,
like
boliye, ma'am.
Yes, Dr. Rajeshwari, yes, you are the expert today.
I just said like that, but I'll tell you, in a menopause already there is a sensitivity for the thyroid hormone is less. So basically they are very prone to go for the hypothyroidism. So in that, if suppose the patient is having symptoms also, and TSH level is high, then one should go for the free T3, free T4 hormone levels, So in that, if suppose if you have a less the free T3, free T4 hormones and increase into the TSH level, then one should go ahead and start with the treatment of this thing. There are two things which happens with the age related. The thyroid, it's getting, one is the fibrosis in that. Second is the thyroid gland itself, it has its own aging, and that can reduce the production of the hormones in that.
So what range we take as normal? The what level?
See, ma'am, TSH, they take the endocrinologist, it goes start from 6 and 7, but the most important thing is they go for the free T3 and free T4 level. If the TSH has rise and some people they are having a normal free T3 and free T4 levels, then they wait and then they tell them to do the exercise and how she benefits in that. But definitely more than 6, 8 or 10 they start in that. And the second important thing is that if suppose some patients are having autoimmune things, so always one should go for a thyroid antibody profiles. This is nowadays complete thyroid profile we are doing with the thyroid antibodies for that.
TPO antibody is very important.
TPO antibodies, that is for the globulin and this thing for the thyroid.
Okay, but FT4 will be, if the FT4, if she's really hypothyroid, then the FT4 will be reduced. That's what you are saying.
Yes. Kind of free T3, free T4, these are the hormones which will get, which will be, if they are reduced, that means they are less available to the body for the every function, metabolic function, cardiac function, or any function, enzymatic reactions and all. So definitely when that they do, we should start for if there is a reduction into FT3 and FT4 levels. In spite of TSH is also in the borderline cases, but sometimes TSH has raised and all these things they are normal, then you can watch it and then you can start it.
Okay. More than 7 you said, more than 6, 7.
6, 7.
Better to take one opinion of the endocrinologist also.
Yes, that is also what I said is of
that is very important in these days.
Yes,
even though we start, if the patient reads something half or the other thing in the Google, that madam, what's that? So better on the safer side in your prescription.
Simple physician also you can
everywhere. At least we can take one opinion. That will be much better.
The endocrinologists they start like this only.
Agreed, totally agreed.
But still we should take it. That is the best thing for the.
Yeah.
Right.
To share our responsibility.
Yes, yes,
Yes,
yes,
and to give
yes.
the benefit to the patient also, na, because
Yes.
we don't know any systemic or autoimmune disorder which is causing her for a going for a thyroid infection.
And reduce our little headache also. That is also very important.
In
No.
one webinar, I heard, Dr. Ritu,
Yeah.
that
Yeah.
supposing it is 70 and above, so they take 10 as 10 also as normal. If the level is raised above 10, then only they will start.
Yeah,
In
they
an-
say, but
Yeah.
generally what it happens in a perimenopause, they are getting symptoms with the 6, 7 also in that. So
Yes.
generally then they go for that. For young patient, their cutoff line is 10 only. But in a perimenopause and menopause, the same thing, patient will have a symptoms also with this, with a, at a 6, 7 level also.
Because she is not, I was
She's
talking
not
about
sustained.
more than 70. If the
Yes.
more than 70, then otherwise she will be mostly about 40s and 50s. No.
Yes, yes, yes.
Okay. Thank you.
Thank you.
So friends, we will wind up for today. So thank you to all of you, those who have joined. Dr. Aparna and my other friends who have joined from Pune. We are planning to have one CME on 19th March. I will put details in the group. So all of you are welcome to join in person. It's around more than 2.5 years we have not met F2F. So do come. I will put in the group. Once it is finalized, I will put in the group. So friends, we will wind up for today. So
Yes,
thank you.
Thank
Thank you,
you,
dear friends.
everyone.
Special thanks to Dr. Rajeshri, Rekha ji. Those all have joined.
Shalini ma'am,
Wonderful
Sangeeta
interaction.
ma'am,
Yeah. So we'll wind up for
everyone.
today.
So we will love to come again on your show. Yes.
Most welcome.
Thank you.
Most welcome. Yeah.
God
Thank
bless
you,
you
Dr.
all.
Ritu, for reminding us in the night. You put another reminder that thank you for that because
Most
after
welcome.
that, I keep on forgetting.
Most welcome. Bye.